Good morning, everybody. Welcome to the information session for the Diagnostic Medical Sonography here at Broward College. My name is Tatiana Kondratsenko. I am a clinical coordinator for this program. I would like to thank you all of you for taking your time to join the meeting today. Before we begin, there are a few things that I would like you to do. First, if you haven't done it yet, please write your email in the message box. We will be sending you some information about the program. And also, I want to ask you to hold off all your questions until we're done with the presentation, because I think most of your questions will be answered at some point throughout the presentation. Okay, there are a few more people joined the meeting. I'm just gonna admit them. So let's begin. The program itself is held at North Campus only. The address is 1000 Coconut Creek Boulevard, Health Sciences, Building 41, Coconut Creek, Florida 33066. The phone number is 954-201-2089. And the website, DMS website is www.broward.edu/ultrasound. Any questions that you might have, you can always go to our Broward College website and in the search box type ultrasound, and our website, which this website, Broward EDU ultrasound, will come up that answers a lot of questions. This information station will be posted on the website as well. All right, there are more people keep joining. Okay. Give me 1 second. Okay. All right, so please know that all sonography courses and labs are offered at Broward College North Campus only. So there are no other campuses. Offers ultrasound programs. So North Campus that located in Coconut Creek Boulevard. It's in the corner of Coconut Creek and Turnpike. Okay. So, here's some important contact information that we have for the program. If you have any questions about the program itself, such as schedule, clinic hours, vaccination, and so on, please contact Ivan Stegrod. He's a program manager. His phone number is 954-201-2089, or you can contact me, Tatiana Kondratsenko. And my phone number is 954-201-2079, and my email address is tkandrat@broward.edu, and Evan's email address is esteigro@broward.edu. So the best way to reach out is through email, because most of the time we're teaching classes or at the clinic sites visits. So when you call, it's more likely that the phone call would not be answered. But if you email us, we are pretty prompt and we can answer your questions pretty quick. Okay. So if you have any questions about admission, you can contact Sylvie Pubin. Her email address is spubien@broward.edu. Her phone number is 954-201-2892. So this Pubin, Sylphis Pubin is admission person, and if you need to, oops, I'm sorry. And if you have some questions about transcript, please contact Mikhail Ishmael. Her email address is mishmael@broward.edu. So if any questions about transcript, she will answer pretty quickly. And please keep in mind, email address is the best way to email us, is the best way to contact us. Okay, so I have more and more people join the meeting. Please write your email address in the meeting chat, whoever entered the meeting, please. Thank you. Okay, what is the pubin email? Sulfis pubin email right here, spubin@broward.edu. You will be able, please ask these questions, like I said, at the end of the meeting, and you also will, I will, at the end of the meeting, I can scroll back and you can write it down. And also this information session will be posted on our website and you can find the information there as well. Go through that PowerPoint and you can write it from there. Okay. Okay, what is diagnostic medical sonography program? So what is diagnostic medical sonography? Diagnostic ultrasound utilizes very high frequency sound to produce images of anatomy and pathology, employs the use of a probe that is placed on the body after applying a gel. The sonographer manipulates the probe in order to transmit sound to specific locations and receive reflection from within the body. Reflections are analyzed by an ultrasound unit and displayed on the LCD screen. So ultrasound technician applies the gel to the patient's body, place the probe on the patient's body, and through the gel, the sound waves goes to the organ, and organ reflects those sound waves, and those sound waves come back as the signal to the screen and as a picture or image of the organ. What is diagnostic medical sonographer? It's an individual who provides patient care services using ultrasound and related diagnostic procedures, must be educationally prepared and clinically competent as a prerequisite to professional practice. Demonstration and maintenance of the competencies through certification by the nationally recognized sonography credential organization is the standard of the practice in sonography, and maintenance of the certification in all areas of practice is endorsed. Functions as a delegate agent of the physician and does not practice independently. Committed to enhanced patient care and continuous quality improvement that increases knowledge and technical competence. Use in independent, professional, and ethical judgment and critical thinking to safely perform diagnostic sonographic procedures. So sonographer provide images of the areas inside the patient's body that allowed physicians to interpret important medical information and diagnose diseases. So sonographer does not make any diagnosis. Sonographer is the person who provides images of the organ and pathology and anatomy for the physician to make the diagnosis. We do write our impression, we do write the report, what we see, and describe what we see and what it measures. And it's up to physician to make the diagnosis, not up to the sonographer. So ultrasound safety, there is no ionizing radiation associated with diagnostic ultrasound. Ultrasound utilizes sound energy only. Although the possibility exists that biological effects may be identified in the future, current data indicate that the benefit for patients from prudent use of diagnostic ultrasound outweigh the risk, if any, that may be present. So as of today, there is no biological effects known. That's why a lot of ultrasound is done uh, for people, for women who are pregnant, and this is the main and most widely used modality um, for look at the fetus's well-being. So, so like I said, biological effect is not known. So there are a few types of, oops, we are ultrasound safety. So grayscale, there are a few types of ultrasound that we use. There are grayscale ultrasound that displays anatomy and pathology in the shades of gray, from black to bright white. So if we look at that image, the bones are the dense structures. They are presented as the white, and the fluid around the fetus. This is the fetus, by the way, and the woman's belly. So the fluid around the fetus is presented as the black. So black will be fluid Everything, the bones, the density, the material is going to be the brighter white, and everything that's less density, it will be grayish. So that's how we look at the different organs and we differentiate them from other structures. And the other type of ultrasound that it used is the 3D ultrasound. Adds texture and shading effects to represent the three-dimensional data set. So widely used in OB setting, when the mother and father, they want to see the face of the baby before the baby is born, or it's also widely used in the echocardiogram uh, before any surgery is performed to look at the valves of the heart. So there are also color flow Doppler ultrasound that shows the pattern and direction of the blood flow. So here we look, it's hard to see, but there is a kidney right here. After completing the ultrasound school, you will be able to see the differentiate between the shades of gray, and that kidney would be more um, stand out for you from the other structures. So the kidney is right here, and the vessels will look at the veins and arteries of the renal veins and arteries of the kidney. So that's called color flow Doppler ultrasound that shows the pattern and direction of the blood flow. Another type of ultrasound that we use is a spectral Doppler. That's when we not only use the color Doppler that was the previously discussed, we also use the measure the velocity. It's called a spectral Doppler. That's when we put the cursor in the middle of the vessel, and it gives us the wave like this, and we can calculate the speed or velocity of the blood flow, which is about 100 centimeters per second. So this is one of the examples of the carotid artery that so spectral Doppler shows velocity of the blood flow over the time. Ultrasound has a wide range of applications, including abdominal ultrasound, obstetrics, and GYN ultrasound, which is gynecology, echo, which is cardiac ultrasound, small parts, which testicle, thyroid, soft tissue, lumps, or any soft tissue abnormalities falls under small parts ultrasound. Breast ultrasound is a separate specialty. Vascular ultrasound, where we look at the vessels. Neurosonography, where we look at the brain and spine, usually done for newly born babies. Musculoskeletal, where we look at the joints. Interventional and intraoperative, it's when we do biopsies of the thyroid nodules or breast nodules, or interventional when the paracentesis, thoracentesis, when the ultrasound guided fluid extraction happens. So let's look at some examples of some of this ultrasound applications. So abdominal ultrasound, this is an example of the liver. We look at the liver, which has this image presents the perfect looking liver in different shades of gray, and we'll look at the vascular. This is the hepatic vein that goes, the blood goes from the liver to the IVC, in inferior vena cava. This image shows healthy liver, and on the other image we can see multiple lesions, which is most likely to be liver metastasis from the main cancer. That's we would be measuring them and present it to the doctor to make the diagnosis. So a healthy liver versus diseased liver. Small parts, we're looking at the thyroid here. This is the right lobe of the liver, I'm sorry, thyroid, the right lobe of the thyroid. This is the left lobe of the thyroid, and it's connected with the isthmus. So it goes around the trachea, and this is healthy looking thyroid. And on the other image, we see the little lesion on the thyroid, which is little nodule in the right lobe because it's on that side. And we would be measuring again and present it to the doctor. OB, which is obstetrics, and GYN, which is gynecology ultrasound, is done for evaluating uterus and ovaries and pelvic structures of the female. Um, as we can see on this image, this is the bladder. As we spoke before, everything that it's fluid is appears black. Everything that it's a dense appears in different shades of gray. And this is why we ask women to drink water to make sure that it's full in order for us to see the uterus, because it compresses on the uterus, elongate the uterus, and we can see the full length of uterus better. If the bladder is full, the uterus will be standing up and it's going to be a lot of bowel around and we won't be able to see it, because fluid serves as it enhances the sounds wave that we send with the probe, with the machine to the organ. It enhances those ultrasound waves and makes uterus more visible for us. So this application is done through the pelvic. It's called a pelvic ultrasound when we do through transabdominal pelvic ultrasound, when the probe placed on the below the belly button and the images are produced. There is another way to evaluate the pelvic organs. It's called a transvaginal ultrasound. When the probe placed in the vagina close to the cervix of the uterus, and that's the images that we receive. This type of ultrasound, when probe is closer to the structure, it gives us better images, more clear images, so we can see uterus better resolution, and some structures we can see better. So on this image, we can look at the uterus. This is endometrium inside the uterus, and we see that nodule, which is darker, a little bit darker, so it's hypoechoic, we call it, compared to the whole uterus, and that's the calipers are placed where we measure in the mass, which most likely to be fibroid, and again presented to the doctor. And this is another image of the transvaginal ultrasound where we look at the pregnancy, and it has twin pregnancy. There are two little fetuses right there, two gestational sacs presented here, and amniotic fluid around. So the probe is right here, and it gives us very good visual of the pregnancy. Another type of ultrasound, it's echo ultrasound. There are two ways to approach it as well. We can do it through the thorax when we place the probe on top of the chest wall, and that's the images we receive. This is a normal looking heart. We look at the atrias of the heart and the ventricles of the heart. We see mitral valve and tricuspid valve. The septum looks nice and thin in between. And here we look at the patient with diseased heart, where little brighter dots are present, which is amyloid deposits in the septum between two ventricles. Again, this and the fluid around the heart as well. It's pericardial effusion, which we don't see it here. That fluid appears black. So this is another type of ultrasound that we also teach at Royal College. Echo is part of one of the modalities that we teach here. So this echocardiogram is done through the thorax. Like I said, the probe is placed on the chest of the patient. And another way to evaluate the heart, it would be transesophageal echo. That's when the doctor will place the probe inside of the esophagus, and the tip of the probe getting closer to the heart. And this is the image we would be receiving. Transesophageal echo offers high resolution images because the probe is closer to the heart. So the closer the probe to the patient's organs, it gives us better resolution and better visual of the little things that it's in the organ. So the cardiologist, this is the hand of the cardiologist, inserts and manipulates the probe, and sonographer in this case assists with the imaging controls. So the sonographer will press the buttons, measure the velocities, if it needs anything to be zoomed or anything to be color Doppler, spectral Doppler, that's what the sonographer will do. the cardiologist will only manipulate the probe and would try to get the angle correctly. Another type of ultrasound is the vascular. That's more likely to be carotid artery. Yes, it says right here where we'll look at the vessel itself and make sure there is no calcifications, that it's blood. Blood is like a fluid, so it will appear black. The walls of the arteries will appear bright because they have a dense material in the walls. And this is the vascular. We put the cursor, measure the velocities, and look at the color flow as well. So I guess the most that this is examples of the most studies that we mostly do at the hospital. There are many other studies that is done, but they're not done as widely as these studies. So sonographers utilize the state-of-the-art equipment to ensure high-quality diagnostic information. Sonographer job description and requirements. Okay, essential functions. Obtains, reviews, and integrates patient history and supporting clinical data to facilitate optimum diagnostic results. Perform pathologic and or physiologic data for interpretation by a physician, records, analyzes, and processes diagnostic data and other patient observation made during the procedure for presentation to the interpreted physician. So if the patient comes sick and has uh, like abdominal pain or vomiting or anything like that, we will definitely put in our report to help doctors to make the diagnosis based on the images and on their patient's history as well. We also, as a sonographer, we do communicate with the patient during the procedure and try to find more information about when it started, what's going on, about the uh, some um, some uh, why the patient is sick, for how long the patient is sick, and all this information will be put on the report for the doctor again to make diagnosis. So exercises, a sonographer exercise discretion and judgment in performance of sonographic and or related diagnostic services, demonstrates appropriate communication skills with patients and colleagues, acts in professional and ethical manner, facilitates communication and education to elicit patient cooperation and understanding of expectations and respond to questions regarding the sonographic examination. Physical requirements, strength sufficient to lift, turn, or position some patients, push ultrasound equipment on wheels, machine can weigh up to 300 pounds or more, and more patient in a wheelchair and stretchers. So if some of you ended up, let's see, you will decide to become a sonographer and ended up working at the hospital, you have to be ready for lift and position some patients, because in the hospital there are different type of patients and different conditions. So the possibility then you will be working with the moving the patient in a wheelchair and stretchers, but you will learn all the techniques at school, how to proper move the patient to not strain your back or to not hurt yourself. The machines, nowadays machines are weighing much, they're becoming lighter and lighter. The technology are improving and the machines are not weighing that much. But anyway, the machines are on the wheels. You don't have to lift the machine. All you have to do is just to push the machine, and it's easy to push anything that has wheels. So 300 pounds. There are some old equipment that weighs that much, but it's not hard to do, but you still should be willing to push the machine. So another requirement is ability to maintain prolonged arm position and wrist flexion necessary for scanning. I think this is the hardest one because if the tech scanning heart, let's see if it's echo ultrasound, the wrist and the arm and the hand and everything will be in the same position for prolonged period of time, and there is at some point, the race can give you some pain, and you should be able to continue maintain that position. And but again, we are teaching at school, we're teaching how to not hurt yourself, and what to do to make sure that you do not harm yourself. So possesses manual dexterity that is adequate to manipulate and operate all sonographic equipment. Possess visual skills necessary to adequately differentiate between subtle shades of gray and make color distinctions. So that's important too. Different shades of gray, as we could see before, the kidney was slightly different from the all organs below. So you should be able to differentiate those little differences in shades of gray. That will help. And some masses and pathology can be just slightly different from the whole organ, and we have to be able to catch that with our eye. It's very important, and it saves a lot of lives. Important skills and attributes: desire to provide respectful, compassionate, and consistently excellent patient care, which is a must. You always will be working with the sick people and people that need to be treated respectfully, of course. So you have to be compassionate. You have to understand that the patient came for the exam because the patient has some issues or concerns. So we have to be patient, we have to be compassionate and provide excellent patient care. Extensive knowledge of anatomy and pathology, absolutely. So that's why the program takes 2 years, learning pathology, learning anatomy. Knowing your stuff is very important, because that's the way we diagnose diseases, or we present normal structures, organ structures. Good hand-eye coordination and spatial orientation, comprehensive knowledge of ultrasound physics and instrumentation will help you to improve the image quality. If you know your machine, if you know your physics, you can always work with improving the resolution and texture of the organ. And detail-oriented work ethics. Qualifications: graduate of the formal diagnostic medical sonography program or cardiovascular technology program that is accredited by the Commission on Accreditation of Allied Health Education Programs is required. The Broward College Diagnostic Medical Sonography program is accredited by this organization. So to be a ultrasound technologist, or cardiovascular technologist or general technologist, you have to complete the school that it's accredited in the Commission on Accreditation of Allied Health Education Program. And Broward College is accredited, so completing this program, you will be able to sit for your license. And it's accredited through the Joint Review Committee on Education and Diagnostic Medical Sonography. Required licenses and certifications: active certifications by the American Registry for Diagnostic Medical Sonography and specialties as appropriate, and current compliance with the continuing medical education requirements set forth by the ERDMS, currently 30 CMEs per role in triennium. So after completing the program, you will be able to sit for your license and get the license, and after receiving the license, you will be able to take exams. And for the certification, different type of certification, which we will be looking um, a little bit in a couple of slides, or next slide, I'm not sure. So that's called ERDMS certificates. There are abdomen certificate, OBGYN certificates, vascular certificates, echo certificates, that ERDMS provide different type of license certificates. And after receiving those certificates, you will be required to complete 30 educational units every 3 years. So when 3 years ends, you will have to show ERDMS that you have been educating yourself for 3 years, doing studying, teaching other students, or having student the clinic sites, scanning with students, or There are many different ways to get those CMEs done after completing the program. We will be going through the options and let you know how to complete those, or any place you will be working will provide you with the CMEs units as well. So it's easy to get as long as you keep a track of it, but you have to complete 30 education units at the end of the every third year per rolling triennium. So RDMS registers and specialties, registered diagnostic medical sonographer with specialties offered in abdomen, OBGYN, musculoskeletal, pediatrics, and breast. Registered diagnostic cardiac sonographer with specialties offered in adult, pediatric, and fetal echo, and there is a registered vascular technologist. So this is a type of registered offered by ERDMS that can be completed sometimes in your career. Not all of them you will be able to complete it right after the graduation. There are only 3 will be offered, and then you can continue with education, and you don't have to go to school. You just can stay home and study on your own and then take the exam. But 3 main certificates will be not provided, will be available for you after completion of the program. You will be able to sit for the exam and for the registry, pass the registry, and then get your certificates. Sonographers can provide their services at hospitals, outpatient clinics, physician offices, research facilities, or may become independent contractors, application or sales specialists for equipment manufacturers, educators, and consults. So there is a wide field, and you can work in many different branches of it. So hospitals is the biggest one. There are many students who graduate start from the hospitals. And then outpatient clinics usually require some experience, sometimes they do not. So hospitals usually take students, they don't look for their experience tags. They're totally fine with the students, and they can train and educate you. And when you become comfortable, you can work in outpatient clinics, you can work in the physician offices, and there are other ways to continue your career. Employment outlook, according to the Bureau of Labor Statistics, employment of diagnostic medical sonographers is expected to grow by 14% between 2024 and 2030. This percentage is much faster than average for all occupations. All ultrasound technology evolves. It will become a more common method used to assist in diagnosing medical condition, favored over more invasive procedures, just because, as we know, as of right now, there is no biological effect. It's very safe modality. It's a very safe way to evaluate the organs. So there are many research put in improving ultrasound, and if we were not able to look at the joints, if we take like 10 years ago, as of today there is an ultrasound for the joints, and because machine is improving, the scientists work on using ultrasound machine in many other fields that the ultrasound was not used before. So that's why we look for the increase about 14% within this 6 years, pretty much. Okay, so competitive salary, sonography salary from the Bureau of Labor Statistics as of 2023. The annual salary is around 78,210, or it's 37.6 per hour. It could be less, it could be more, depend on your experience, depend at the place where you've been working, and depend on the type of ultrasound you will be performing, because they're all priced differently. So, but the average salary is about 78,000, and the average per hour is about $38 an hour. Program requirements and admission, which is one of the most important chapters in this information session. Please pay attention. So courses to be completed before applying to the sonography program. Please pay attention that it's before. So all these courses must be completed before your application because when you apply to the program, it's based on the points earned. If you haven't completed the course and you're still starting the course, you did not get any points for that yet. And we are taking only about 20 students per year. And if somebody has higher points than you do, then you won't be able to get that spot. So make sure you complete all your prerequisite courses before applying to the program. Points awarded is according to the final grade in the course, A, B, or C. So the courses that prerequisite courses are physics or radiographic physics, algebra, composition one, speech communication or introduction to public speaking, anatomy and physiology one, anatomy and physiology lab one, anatomy and physiology two, anatomy and physiology lab two, general education humanities, history of the United States since 1877 or national government. So all these courses must be completed. Additional points awarded is radiography. If you have completed radiography program, you get additional 20 points. If you completed a associate degree in health science, you get 17 points. Master degree or higher, 15 points, bachelor's 10, and associate degree in any other field is 5 points. Also, overall GPA maximum points is 4. This is your 4 points for GPA from 4 to 3.75, and then 3, 2, and 1 points for all this GPA grading. So as we spoke before, campus that offers the program is only North Campus. The program begins in June every year and the end of June. This year it begins on June 27th. And we already completed with people already apply, and we are right now in the process of calculating and see who got into the program. Application period is November 1st to March 15th, so we're talking about 3.5 months. It's a big period. So if you started the course, let's see, in January 1st, and you will be done with the course by March 5th, it's usually that's the time of the spring break. So please complete the course and apply on before March 15th. You still have 5-10 days left, or if you even apply on March 15th. It doesn't matter when you apply, at the beginning of the application period or last day of the application period. We go by the points. Whoever got the highest amount points has a more chance to get into the program. If you have less amount of points, you have a less chance to get into the program. So keep in mind, it does not matter what day you choose, as long as from November 1st to March 15th and you have a high amount of points. So admission requirements, once all prerequisite courses are completed and graded, you can apply to the program between November 1st, March 15th of each year. This is the link how you can apply it. All students must have a minimum GPA of 2.5 to be eligible for admission. Admission is based on the point qualification system. There is no waiting list. We just talked about that. So point qualification system, and we do not put you on the wait list. So if you did not, it didn't get into the program this year, next year, since we do not have a waiting list, you have to apply again. You will be applying again in comparison with other students, and again, based on the points system. There is no waiting list. Once accepted, physical examination and immunization is required, including all vaccines. Vaccinations, we're talking about childhood vaccinations such as mumps, measles, varicella, hepatitis vaccines, the main vaccines that are required when you were a child. At this time, now about the COVID vaccine. At this time, clinical affiliates do not have mandatory current vaccine
COVID-19 vaccination requirement. So it's no longer required to have the COVID vaccine. Clinical affiliates currently mandate the flu vaccine and could reinstate the COVID-19 vaccination requirement at any time. And if so, students will be required to have the COVID-19 vaccine in order to attend clinical rotation, allow them to progress in their program of study. So as of today, flu vaccine is mandatory. You cannot be at the clinic site. It's not the Broad College requirement. It's solely the clinic site requirement, hospital requirement. None of the hospitals will take student if they do not have a flu vaccine. So you will have to do the flu vaccine once a year during September, beginning of October season for the flu season. It's a must. Now, COVID vaccine is not required. If you have one, good. If you don't have one and you don't want to get one, okay, you don't have to get one. But if at some point the hospital will change their mind and say, like, we want all students to have a COVID-19 vaccine, you will have to, oops, where am I? You will have to get one in order to continue your clinical education. Again, not about college requirements. It's all based on the clinical requirements. And if you want to complete your the program, you have to be able to do the COVID vaccine if it become a requirement in the future. So student must complete certifications in areas such as CPR, TB, OSHA, and also we will do the background check and drug screening. It's a requirement and it's a must. And if you did not pass any of those, if you didn't pass background check or drug screen test check, then you won't be able to continue the program or get into the program. So specialized sonography courses begin in June, usually at the end, not usually, always at the end of June. Like I said, this year it begins on June 27. It's usually after 20s. 34 hours per week is spent in class and clinic. This does not include study time, so it's a lot of hours spent in the program. The DMS Associate in Science degree is awarded upon completion of the 2-year course of study. So we offer an associate degree after completing the program. Graduates are eligible to sit for the ER DMS registries in abdomen, OBGYN, and adult echo. So these are 3 specialties that we are offering after completing ultrasound program at Broward College. And I think Broward College is one of the only, or maybe one of the colleges, maybe some other colleges start offering uh, this registries as well, but we used to be only the one that would offer only, not only that would offer 3 registries. Usually schools offer only 1 or 2. And abdomen, OBGYN, and echo is the widest, the most commonly uh, ultrasounds used. So if you think about it, if you go to the doctor, they want abdominal ultrasound. If you go to the GYN doctor, they want OB/GYN ultrasound and echo doctor. So the other wide specialty is vascular. We do not offer vascular, but you will be able to complete vascular after completing the program, study on your own. You can have a book, study on your own, and go past the registry. You don't have to go to school to complete the vascular in the future if you would be interested. It's if you will need it or if you will be interested. There are many other specialties that we talked about it before, and you will, if you decide in the future you want to get the certificate in any other modalities, you can study on your own and complete them. You do not need to go into the school in order to get the certificates done. So we talk about the prerequisite classes, which is on top. We're not going to talk about them again. You can just take a look. Now let's talk about the courses. Ultrasound program starts in June, and it's a 2-year program. To be exact, it's 22 months program. So it starts in June. Let's see, whoever started June this year, 2024, they will be graduating in May 2026 in 2 years. in May 2026. So all classes are already set at the specific time and dates. There is no pick and choose. You cannot pick the time, you cannot or choose the day. They're all set, and this is the program, and you have to follow the program schedule in order to complete the program. Term one is the summer program that begins in June till August. It's only 6 weeks term, but it's very quick and very intense. There are a lot of material studied. The sonography circulatory system that I will be teaching, it's only once a week on Wednesdays, and principles and protocols are twice a week. It's usually on Tuesdays and Thursdays. The days can be changed by the next year. I don't know what to expect next year, but this year it says Tuesday and Thursday for principles and protocols, 8 hours a day, and sonography of circulatory on Wednesdays from 8 till 2:30. So it's 6.5 hours. So it's 3 days at school. You will be studied, like I said, it's 6 weeks, but it's very intense and a lot of material to cover. Then term two begins in August and ends in December, and you will be studying physics, sonography physics, abdominal sonography, which you will be studying anatomy without the pathology, and OBGYN anatomy without pathology, and of course the lab and clinical education that will be the clinic site rotations. So we do not have a clinic site on the term one because we have a lot of lab during the principles and protocols of sonographic imaging. We are preparing you, we are teaching you how to look at the organs and what to look. So before you start your term two, you're already familiar with this machine, you're already familiar how to scan the patients, and you're familiar with the organs that you're looking at. In term two, you will start your clinical rotation that will be 3 days a week. And classes, this all four classes will be 2 days a week. It would be Tuesday and Thursday. You will be at school from 8 till 4, and you will be at the hospital 3 days a week from 8 till 4:30, or as of today, we have different clinic days. It can be weekends, it can be Saturday, Sunday, it can be any day of the week, but not Tuesday and Thursday because you will be at Broward College on the campus on Tuesdays and Thursdays. But 3 days, it can be any other day. It can be Monday, it can be Wednesday, it can be Friday, Saturday, or Sunday. So we do have clinical rotations on the weekend. And we also have different times. It can be from 7 till 3:30. It can be from 8 till 4:30. It can be from 10 till to 7. It can be from 2 to 9, or that's it. I think that's all time frames that we have at the clinic sites. And you will be placed at the clinic based on what you need in the program. If you did not have enough GYN or OB scan, you will be placed based um, on your scanning, on your on on your scanning from the previous classes. So you cannot request any clinic sites. It will be set for you by the clinical coordinator, and we will go from there. So term three is pretty much the same as the term one. We would just have physics 2, where you learn more about physics, the OBGYN, where you will be learning about pathology, abdomen pathology, practice aspect of sonography 1, that's where you will be reviewing everything that you study in your term 2. And of course, the lab, fundamental sonography lab. We have lab with every term that will be practicing and continue improving your scanning techniques. And clinical education is the same as in term 2. It will be 3 days a week, from 8 hours a day, 3 days a week. So here you will be pretty much you will be spending 5 days for Broward College, term 3, 5 days for Broward College. It's like full-time job. And term 4, you have only one class, which is small parts, but you will be going to clinic sites 4 days a week. So it's still 5 days, 5 days a week, Just 1 day at Broward College and 4 days at the clinic sites. Term 5 and term 6, you will be spending at Broward College 4 days instead of 5 days. And you term 5 and 6, it's echo terms. You will be studying echo, anatomy of the heart, and the practice at lab how to scan the heart. And another class that you will have online is the practice aspect of sonography. That's oh, maybe not online. I'm not sure. It can be online, can be in class. So in this class, you will be reviewing everything that you studied in term 2 and term 3, and that will get you ready for your that you don't forget the material that you studied before. So we need to keep practicing and reviewing this information for you to take your registries. And clinical education will be 3 days a week, 2 days at the echo hospitals, and 1 day continue general hospital, continue improving your skills in the general. In terms 3, you will be learning pathology and echo, and also you will have lab again. You continue improving your skills, and seminar in sonography will be as well, where you continue reviewing uh, the general abdominal and OBGYN ultrasound, and getting ready for your registries. And clinical education will be 3 days a week. So 3 days a week clinical, 3 days, 4 days, 3 days, and 3 days, and it's 8 hours a day. So the program is, like I said, it's set. There is no pick and choose, and a lot of hours. You would need a lot of help from your people around you, and that will need you to help you to study by giving you peace and time to study for your classes. So tuition and fees. As of right now, the total estimated cost of the ES degree program is $14,088.80. You can look at that breakdown. It haven't been changed much for a while, so. And our program is, I think, the lowest cost than any other schools will cost you. Okay. So why choose the Broward College Sonography program? 90 to 95% of BC students pass their DMS registry examination. So our program is very well developed, and we prepare you for your DMS registries pretty well. So we have a high percentage of students who is passing their DMS registries. Without those registers, you won't be able to work on the field. So it's very important to be prepared to take those registries. And Broward College is pretty good in educating students. Also, 95% of BC sonography students that is successfully passed the AirDMS registry examinations are working in the field. If you get into the program, and when you're gonna go through through the clinical rotation and see how many former students, you will meet a lot of techs who has been a student at the Broward College, and many students find a job even months or 2 months before the graduation, because the clinic sites ask them to come back in order to hire them. And when they talk to the clinical coordinator, they can make the request, and we are always going towards to help clinic sites and student to find a job. So if the clinic sites request the student back, we're always willing to place the student back. And most of the time, I don't even know if they ever didn't hire anybody, but every time when they ask for a student to come back, it's always the job offer right after. So a few more good reasons: instructors with over 35 years combined ultrasound experience, small classes sizes. We have 20 students, so our lab has a lot of machines, and students are able to scan a lot. So we have more than even 10 machines. So it's 2 students per machine. So since one student has to scan another student, so it's 2 students per machine and one student scan, one student being scanned, and then they switch. And that's good to have a small class because you get in more experience. Comparably low program cost. Like I said, I think our program is the lowest cost program in South Florida. So, and we offering so many certificate after completion. So that's something to think about. Broward College has graduated excellent sonographers in our community for over 30 years. So this program has been for over 30 years, which is good sign as well. State-of-the-art lab incorporate Phyllis Visor and HD11 scan stations as well as the VidMax and UltraSim simulators. So what it says, for those who doesn't know much about machines, it's just the simulators because there are some studies that we cannot perform on the students, such as let's see, OB studies. Not many students come pregnant to the program, and even though if they come pregnant, they probably don't want to be scanned all the time. So we have those simulators. We have um, ladies that the simulated ladies that have a pregnant uterus, and we can study from there. Also transvaginal test we can study testicular exams. There are many other simulators that we have in the lab that you can study in the lab, not on the patient, not on the students, because it's impossible to study on the students. And when you study in lab and then you go to the clinic sites, you're already familiar with anatomy, and then you feel more confident scanning patients since you already practice scanning simulators. Comprehensive clinical training can Broward finest hospitals and clinics. We send students to many hospitals. We have a contract with Broward Health, with Memorial System, with HTA hospitals, with many small offices, and you'll always have a place to complete your clinical education. All right, I think that we have completed the information session today. Again, if you have any questions, you can check our website at www.broward.edu/ultrasound. If you forget that website, just go to Broward.edu, and on the right-hand side on top, it's going to be search box. You just type ultrasound and it will brings you to that website. You will see this information session PowerPoint posted as well, this Zoom meeting. So you can go over, and if you need to write it down, some information, you can find it from there. Also, I want to ask one more time for those people, because there was more and more people join the meeting during the meeting that I admitted. So please don't forget to type your email address in the meeting chat. It's very important because you will be receiving some information about the program. So please type your email address if you haven't done that yet. If you already type your email, please disregard that message. So, but for those who didn't put your email address yet, please do so. So now it's time for questions. Please ask questions. If you don't ask questions, you don't get the extra information, but this information session is made for you to get all your questions answered. I have one question here, a quick question. If some of us are missing all of the anatomy prerequisites, will we be able to take them all in full, or they can't all be taken together? No, they cannot be taken together. You have to take anatomy 1 first and lab 1 first. After completing anatomy 1 and lab 1, it will let you take anatomy 2 and lab 2, but you still have time you can take during the summertime. So I would go and sign for classes for summertime, and there are quick courses that you can complete within like months and a half. I don't recommend, because you don't learn much. You just study a lot, but your mind does not remember many things, and it's very hard because anatomy classes are very hard, one of the hardest classes to take. So I do not recommend months and a half, but there is an option in case if you need a quick one. So there is a 6 or 7 week courses, quick one. So, but I would go with the summer anatomy 1 and lab 1, and then in the fall take anatomy 2 and lab 2. All right. So anybody else have any questions? Are there any exceptions to the exams before I go into the program if I have already studied at the university and passed some of the exams? If yes, who can contact to specify which exam should I take? I believe you're talking about the classes that you have completed. I'm not sure what do you mean by the exams. So please uh, contact Sophie's Mikhail, are you here today?
I'm here, but I'm not sure what
Oh, you're not sure
exams
either,
you're
right? Exams.
referring
Okay.
to.
Okay. Okay. So I believe the student talks about the classes being completed at the, but I'm not sure. Or the student was in the ultrasound program. I don't know. Can we get some more exams which will should take before we go into the program? Again, Olha, you are talking about the classes that you have to complete, correct? Let's see at the, hello, I'm wondering if
And exams.
physics basically taken Miami-Dade College meet the requirement for PHY 101. Thanks. That's maybe
You
for your
could do
question.
yeah, you could do a substitution. I've seen where basic or college physics classes taken at other state colleges have been substituted for the physics.
Okay, thank you. Has the deadline for this program passed? Yes. March 15th was for this year. For this year, it was November 1st till March 15th. So we passed the deadline. Ready to have students who apply to the program, and currently we're working on see who got into the program, who is not. So the next opening will be November 1st this year. So that's when you can apply to the program. Okay, so shifts pro, oops. Mm, what did I do?
And you have a part-time job.
Let me see. She talks about,
It's not recommended because of how rigorous the program is, Trina. Um, and
okay,
again, depending on where you're placed for clinicals can determine the time for that can vary.
yeah, for part-time job, I mean, I have, in term two, I know clinicals can be on the weekends. What would you recommend to do students who are in the program work? I have very few students. Most of them quit working. As of right now, I have one student who is a second year student that still have her job. And
But struggle.
students, they struggle,
Hmm.
and they always tell me that it's how hard it is, and they're not doing their best when they're in the program. And you don't want to get in the program and then not pass any exams. It's really hard. I do have part-time couple students, but do I recommend? Absolutely not. Um, but I understand that you have bills and you might have a family and all of this, and it happens. So it's first of all, it depends on the student, how responsible the student is, and how well you can learn the material. Because some students have a very good learning techniques, I don't know, and some of them can study and learn material really quick. So it's all based on you, but I would recommend when you get into the program not have a job get familiar with the course, get familiar with the program, and see if you can fit your part job in your study process. So, but at the beginning, I would recommend not to, just to get the feel of the program, how it feels to be in the program. And then if you feel like you do have a few hours there and there that you can spend for working, then why not? Uh, now, Olha, are you talking about these classes? I open up the page. I just wonder if she was talking about 10 exams which you mentioned before. 1, 2, 3, 4, 5, 6, 7, 8. It's 9 here, so but I believe she was talking about this. Does intermediate algebra satisfy for the college algebra?
It does not.
It
Has to
does not.
be it has to be college algebra. There is MAC 1105C, which is a combination of intermediate algebra and college algebra. That is okay, but it has to be college algebra.
Okay, and Olha was talking about these classes that it's on that I shared the screen. She said yes. So her question was, are there any exceptions to the exams before I go into the program if I have already studied at the university and passed some of the exams? I
Some of the
guess you have
classes, mm-mm.
some of the classes. I believe she has to bring the transcript, right?
Correct. You would have to
And
apply, submit all transcripts. If you have the classes that are equivalent, they'll transfer in. If they don't, then you would do a substitution with your advisor. But remember that points are awarded based on the completion of these courses. So if you don't have all these courses, you have a less likely chance of even being admitted to the program.
okay, let's see. Okay, we answered this question. I just okay. Okay, I got you. All right. Anybody else have a question? I think I didn't miss any question. You can speak too if you would like. You can unmute the microphone, or and if you don't want to type. Okay. One new message. Okay, that's not the message. I asked one more question.
May I ask a question?
Where?
Trina, 1 second. Oh, if
Trina.
she decides to work weekends, how far will she know where she is placed for clinicals?
So first of all, you don't make a decision to work on the weekends. We have just a few clinic site that goes on the weekends, and it's up to clinical coordinator. It's not up to student to decide. It's all depend on their previous clinical experience, and some clinic sites have more GYN studies, some clinic sites have more OB studies, some clinic sites give you more abdomen studies. So if you went to one clinic and you were not able to scan GYN and you need GYN for this semester, that's where the clinical coordinator will place you. So, like I said, it's not up to you to decide. It's up to the clinical coordinator, and clinical coordinator will provide you with the schedule within the at the end of the semester, like 5, 6 weeks
Before.
before. Right, right. It
Yeah.
depends. During the summer class, we have to wait pretty much till the end, so you will know your schedule only like 2 weeks before you begin your 2, 3 weeks before you begin your rotation. During winter, your rotation begins in June, but you will know your clinic site in November because it's a big winter break there. So just the first, well, I'm sorry, after summer, that would be the shortest period of time for you to know the clinic sites, because we have to, after first semester, we have to wait longer for first semester graduates to see who complete the first semester, who doesn't. So before we place them anywhere, but then when you get on your second term, then you will know at least 6 weeks before you begin your rotation following that second semester. So you have 6 weeks to make your work decisions or arrange the time and everything. Okay, anybody else have a question? Okay, I guess we have no more questions. All right, I guess we are done for today. Again, if you need more information or if you want to review what we discussed today, please. Okay, we do have one more question. I have an AS physical therapy from BC. Will I have to submit transcript again? Probably not. I don't know if it's at BC.
No, if all your courses have been at BC, you won't need to resubmit anything.
Okay. 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 So again, please, if you have any questions, always can refer to the Broward EDU ultrasound website and look at the information that you need for yourself. And I want to thank you all of you um, for coming to the meeting and be with us today. You all have a great day. Thank you.